are a slew of options for depression. When it comes to first-line choices, we're primarily talking about SSRIs, SNRIs, and derivatives of those. But once you move past those, you have older classes of medicines like tricyclics and MAOIs. Unfortunately, some psychiatrists don't prescribe them anymore. They've forgotten about them in a way, but they still have a very important role. But beyond that, there are strategies of combining those more typical antidepressants. There are many augmentation strategies that one can use. Some of those have specific FDA-labeled indications. Some of them are more off-label. There are many medicines that have an established history and research evidence to support them as being useful for treatment-resistant unipolar or bipolar depression. Specific examples of some of those off-label treatments that have been used for some time. Thyroid hormone supplementation, Mirapex, Pimbalol. There are some medicines that have long been available outside the U.S., but mostly because of patent considerations aren't available here, but which are very useful, and I use sometimes medicines like tianeptine or clobamide. There are lots of options out there, but with any of these choices, you don't know ahead of time who will respond to what. They all carry some degree of risk. They all have their own side effect profiles. Some have stronger evidence to support their use versus others. With some of them, there may be some evidence to support their effectiveness, but the gains above and beyond what they've already achieved with other more typical agents may be relatively slim. You then start thinking about more procedurally based things like electroconvulsive therapy, transcranial magnetic stimulation, deep brain stimulation, vagal nerve stimulation. But with all of these things, there's some lag time to potential effect. It can be weeks, months, if these things will work at all. One of the unique things about ketamine is that it is a single infusion that we're looking at to determine response. And we're going to know within hours to at most a day whether this is something that one responds to.